Hello everyone, my name is Tara Parks and this is my oral presentation practice submission for HCML 301. So a little bit about me. My husband and I have been married for 20 years and we live in Graham, Washington. I am the mother of three wonderful children, ages 18, 12, and 10. I spend a lot of time with the children between their band concerts, their PTA meetings, sports events, and such, and they keep us both very busy. For my job, I work as a registered vascular sonographer, and if you're not familiar with that line of work, I basically use ultrasound to image the vascular system. I work for a group of vascular surgeons, so we do a lot of pre and post-operative imaging. One of the tests we do most often is what we call a lower extremity venous Doppler, which is when I image the veins of the legs to check for deep vein thrombosis or blood clots. I've been doing this for 15 years and I still love it and I love my patients. For my educational goals, I am working towards a degree in medical management and I have 3 quarters left. One day I hope to manage a radiology department or something similar within the hospital system. Once I finish my bachelor's degree, obtaining a master's degree is something I have considered, but I would probably take a break from school for at least a year or so to decompress. There are several things that I have been very excited to have learned about in this program. The first being management style. I have a tendency to act on my feelings and my intuition, which may not always be the best way to lead or deal with a situation effectively. So knowing the different styles of leadership has been very helpful in giving me a broader base from which to lead rather than using my own personal feelings. Another thing that I have really been grateful to have learned is the medical and social ethics that have been presented during this program. There have been many eye-opening situations and thought projects that have opened my mind to see things from others' perspectives and point of views, religious and cultural point of views. And there have been some tough moments where some of the things I've read and watched have made me disappointed in humanity, but other stories have shown me that there is good in this world and it has helped restore my faith in people as well. Another thing that I've been grateful to learn is the basic business language and skills. I was ignorant to a lot of the ground level business rules, how businesses work, how they can be run, and even on a grander scale, the Federal Reserve and how government controls the economy. All of these things I was not necessarily knowledgeable about, so I'm very grateful to have been given that information. So what have we learned during this presentation? Basically who I am. I am a mother, a wife, a vascular sonographer, and a student. And I've touched on what I've been grateful to learn. That is management styles, medical and social ethics, and basic business knowledge and skills. So thank you for your time and watching this video, and I hope to work with you all this quarter. Thanks again.